This is the Rethink Report, where we don't just report the news, we question it. The Irish government is facing mounting criticism for failing to meet its pre-election promise of reducing waiting times for children's spinal surgeries. Despite pledges to prioritize urgent procedures, 37 children have now been waiting over 6 months, with some enduring delays exceeding 2 years. For families of children suffering from scoliosis, spina bifida, and other severe spinal conditions, these delays can mean crippling pain, permanent disability, and reduced quality of life. Government pledges versus reality. In early 2023, former Health Minister Stephen Donnelly assured the public that waiting lists for spinal surgeries would be drastically reduced. The government promised to expand hospital capacity, hire more specialists, and send patients abroad for treatment if necessary. Yet, despite these commitments, the backlog remains alarmingly high, with 230 children still awaiting critical operations. While this number is a slight decrease from 287 in July, it falls far short of expectations and continues to raise ethical and political concerns. Why are these surgeries delayed? Lack of operating theaters and staff. Hospitals report limited surgical slots, a shortage of orthopedic specialists, and overstretched resources. Funding and resource allocation. Despite government commitments, funding distribution has not kept pace with demand. Bureaucratic barriers. Families who sought overseas treatment face lengthy approval processes and financial obstacles. Public outrage and growing political pressure. Opposition parties, particularly Sinn Féin, have slammed the government, accusing them of breaking promises and failing the most vulnerable. Health spokesperson David Cullinane has called the situation a national disgrace, urging immediate intervention. Meanwhile, advocacy groups like the Irish Son's Kids Can't Wait campaign have amplified families' voices, exposing heartbreaking stories of children who have suffered due to the system's inefficiencies. The bigger picture: a broken healthcare system? This crisis raises broader questions about Ireland's healthcare priorities. If an issue as urgent as children needing spinal surgery is sidelined, what does that say about the system's ability to care for the population? Is this just another case of government failing to deliver on election promises? Or does it expose a deeper crisis in Ireland's public health system? The Rethink Report doesn't just report the news, we question it.